video has been more requested than any other subject I've encountered. Today we're going to talk about transfer addiction or addiction transference. What is it? Addiction transference is when you have an addiction to something, are no longer able to have access to that thing, and therefore transfer that addictive behavior pattern to something else. In the bariatric surgery population, studies have shown that up to 58% of people who get bariatric surgery have some level of food addiction before their procedure. So when the ability to use food is then taken off the table, patients can sometimes end up turning to a different substance or activity for coping, stress relief, or a dopamine rush. This can be anything such as alcohol, to sex, to gambling, or even strenuous exercise like running. One of the key signs of food addiction is a loss of control when eating. If you feel like you want to stop but can't, you eat to the point of feeling sick, or you feel ashamed or guilty about your eating, you may be suffering from a food addiction. Certain risk factors have been seen in addiction, including adverse childhood experiences, abuse, neglect, trauma, family history of addiction, and even genetics can contribute to addictive personality or behaviors. The only way to truly know is to get assessed by a mental health professional. Let's say you have one. Can you prevent transference? Remember, bariatric surgery is just a tool for weight loss. It does not address the psychological or emotional associations with food. If you're planning to get surgery and fear you may have an unhealthy relationship with food, different forms of therapy and mental health treatments can help you manage your condition. It's incredibly important to seek treatment and learn how to cope in healthy ways, regulate your emotions, and resolve these triggers before you undergo bariatric surgery. If you've already had surgery and think you might have transferred an addiction to another vice, there is still hope. As you've probably heard, the first challenge is admitting to yourself that there is a problem and reaching to a place where you want to seek help. If you've made it there, first off, I am so proud of you. That is a huge step. And secondly, don't lose steam. Seek support through individual or group therapy, as well as any other mental health resources that you have at your disposal. Remember, you are not in this alone. There is a whole community out here cheering you on and helping you get to where you need to be. And as always, if you have a question about bariatric surgery and I haven't gotten to it yet, drop a comment below and I'll try to get back to you.